All right, so this is some of the anatomy that you might encounter on your stational exam. So remember that for every cusp a tooth has, there's also a triangular ridge. The triangular ridge goes from the cusp tip to the central groove. So if we were going to identify these individually, we would want to know this is the mesial side of the tooth, this is the distal side of the tooth, and then we also have to know buccal and lingual. And so remember, this is a mandibular molar, so we're going to look at that. We're going to look at the buccal ridge, which is the buccal belly bulge. And so this is buccal and this is mesial. So that makes this the mesial buccal triangular ridge. So this is still mesial and this is lingual. This is the mesial lingual triangular ridge. So this is the distal aspect of the tooth. So distal buccal triangular ridge, distal lingual triangular ridge. So on the mandibular molars, they have what we call transverse ridges. So the transverse are ridges that go across the tooth but stay on the same side. So this is the mesial aspect of the tooth. So this is the mesial transverse ridge. And I think about that as like the V, see how it's staying on the same side of the tooth as the V in transverse, because this kind of looks like a V. So transverse ridges stay on one side of the proximal surface. So this is mesial transverse ridge, distal transverse ridge. Okay, so on premolars, they also have a transverse ridge, but it's a little different because this is a buccal triangular ridge and a lingual triangular ridge. Combined, these make a transverse ridge. No mesial, no distal, just a transverse ridge. All right, so on maxillary molars, we have something that we call an oblique ridge. So the oblique ridge, first of all, what is this structure right here? Cusp of Carabelli. So that makes this a maxillary first molar. I'm bringing it up because the cusp of Carabelli is only on the mesial lingual cusp. So now I know that this is mesial lingual. So in terms of identifying these ridges, I know that this is the mesial lingual triangular ridge. So then I know that this is the mesial buccal triangular ridge. So this is a mesial transverse ridge. The oblique ridge extends from the mesial lingual to the distal buccal. That's where it always is. It's never the other way. It's always mesial lingual to distal buccal. Or you could say distal buccal to mesial lingual, because that's the same thing. So on a maxillary first or second molar, it has one transverse ridge and one oblique ridge. Okay, so another thing that you might encounter on your stational exam is this. We all know that this is the CEJ, but if you just say CEJ, that's not enough. You have to know whether this is mesial, distal, buccal, lingual. So we're going to evaluate the root of the tooth. And in this situation, I can see part of the mesial buccal root from this aspect. So I know that this is the distal buccal. So this is the distal CEJ. So if this is distal, that makes this mesial. So this is the mesial root trunk. And the difference between a root trunk and a furcation is that the root trunk goes from the CEJ to the furcation. Just this little aspect right here is the furcation, not to be confused with the crotch, which is in here, okay? So there's that. All right, last but not least, there are also ridges on the buccal surface of the teeth and also the lingual surface. But this is a mandibular first molar because it has 5 cusps. And the smallest cusp on a mandibular first molar is the distal. So I know this is distal. I know this is buccal because it has the 3 cusps from the buccal view. So that makes this the mesial buccal groove, the distal buccal groove. Sometimes people are lazy and call this the buccal groove, and I would take that on the stational as well. But this one definitely has to be called distal buccal. And I think that's it. Hopefully that was helpful.
Yes.